In early June, John and Suzanne Clark were preparing for the arrival of their son. Having suffered 2 previous miscarriages, the Clarks were happy to reach the 30th week of Suzanne's pregnancy with no complications, but their happiness was soon short-lived.
In the beginning, it seemed to be quite normal. Everything was running smoothly. Nothing really jumped out to say there's going to be any problems. We got through the first 12-week mark where you can lose the baby. Then we got through 24 weeks and then we thought, okay, we're fine now, because that's when we lost the twins at 24 weeks. And then 31 weeks, that Sunday night, Monday morning, when I went into preterm labour, we thought, uh-oh, here we go. And then that's when we found out that he had the fluid in his chest and in his lungs.
My immediate concern was that if we did lose the baby in that, like, would Suzanne be able to recover from that after, you know, we were both devastated after the loss of the twins, and to have it happen again, I don't think we would have come back from that.
Dr. Abdul Sheikh was the pediatric surgeon on the team caring for the Clark's unborn son, who was diagnosed with a condition called hydrops fetalis.
Timothy had an unusual condition where he had developed fluid around both his lungs. The fluid was compressing the lungs, and by pressing on the lungs were unable to grow. At the same time, as the fluid accumulated, it pressed on the blood vessels going to the heart, and what this caused was the heart to fail because there was inadequate blood flow back to the heart. It's unusual in that both sides of the chest cavity were involved and both lungs were being compressed. By the time we saw baby Clark, he was already in cardiac failure or had a condition called hydrops.
Together with the Clarks, the medical team decided to perform a rare in utero surgery, inserting a double shunt into Timothy's chest to drain the fluid.
Timothy was in serious trouble in terms of the hydrops. He had been deteriorating over 2 to 3 days that he had been scanned by our obstetricians, and his condition had been steadily deteriorating. He was of what we thought an inadequate weight and a size to have a good prognosis after birth. If we had delivered him at that period of time, there was about a 30% chance of him actually surviving. If we managed to treat the condition and allowed the lungs to grow, and if we allowed the heart to develop and recover from the cardiac failure for about 8 to 10 weeks, then once baby was born of a reasonable weight and with lungs that would function properly, he would have a better chance.
Timothy made medical history as the first baby to have a double shunt inserted in utero. It took just 25 minutes using an 18-centimeter long needle.
The equipment that we used for the procedure included the shunt itself. This is made out of special plastic with multiple holes on both ends of it and a tube connecting the 2 curves. The curves themselves make sure that the shunt stays in the baby's chest cavity, draining fluid out into the mum's amniotic cavity. The needle that is used has a special end which is easily seen on ultrasound. Once the ultrasonographer has confirmed the position that we are going to place the shunt in, the needle is inserted into the cavity. The shunt itself is then straightened out using a special wire. The shunt is then inserted into the needle. As it is deployed, the shunt regains the shape that it had before the wire was inserted, and the 2 pigtails slowly deploy. Once the first curve is deployed, the needle is then gently pulled out of the baby's chest cavity, keeping the tube within the chest cavity. And once it is out of the chest cavity, the second pigtail is then deployed, ensuring that that end of the tube stays in the mum's uterus. The fluid then drains between the 2 ends of the tube during the period of time that it remains in the uterus.
Timothy was born on the 22nd of July, weighing 2.65 kilograms. The shunts inserted 5 weeks prior to his birth were removed shortly after his arrival.
The whole experience has been a little bit overwhelming, but I'm just relieved everything worked out perfectly, and I'm just loving every minute, every second of being a mom.
We're not deeply religious people, but yeah, there was something else that was involved here as well.
I like to think of his double shunts as his little angel wings from his sisters that passed, the little twins.
After surviving a world-first surgery and making headlines before he was born, little Timothy Clark certainly has a bright future ahead of him.